off with nutrition. So myself, Hina, this is Jian, Michael, and then on that side we have Jenna and Bhumika. We'll be having more people joining us shortly. But Jian, Michael, and myself, we're going to start off with nutrition. So I'm going to pass it over to Jian. She's just going to do a little brief overview about nutrition, and then also we'll have questions at the end that you guys can ask us, and we'll be here available. Thank you.
Hi everyone, my name is Jian. So I just have a question for everyone. Does anyone have any idea what a healthy mouth might look like? Like, what do you think your gums look like if they're healthy? Red. Anything else?
Glow.
Yeah. Glow on the face. Yeah. Sorry? Smooth. Okay. Okay. Yeah. Okay. Sorry? Brown. Okay. Yeah. Yeah, that can happen over time. So healthy gums have a firm consistency and may have, like, do you know what an orange peel looks like? Sometimes there's little dimples in the orange peel. Yeah, so if you look closely in the mirror and if you look closely at your gums, you'll see that healthy gums typically have a little bit of dimpling on the gums, but it doesn't always look like that, okay? So if you don't notice that your gums look, well, healthy gums typically look not red, because red is actually a sign of disease, and we call that gingivitis. And if your gums look a little more red than they usually do, maybe it's because you're not brushing too much or you're not flossing too much. And maybe you should start doing that over time. You'll notice that your gums will look a little less red. So today, in regards to health, we're going to talk about specifically how nutrition can play an important role in making sure that your oral cavity, your gums, and your teeth are healthy. Okay? So is anyone here aware of the Canada's food guide and what they recommend? Yeah. But yeah?
Yeah, so the 4 food groups.
Yeah.
So half of it should be veg greens,
Mm-hmm.
and a quarter should be proteins, and
Yes.
a quarter should be starches, potato, rice, whatever.
For sure. A plus, exactly. So yeah, like she said, sorry this isn't in color, but when you look at a plate in the Canada's food guide, you want to make sure you follow that half of your plate is fruits and vegetables. And a quarter of it, like she said, should be proteins, whether that's from animals or from vegetables. Just make sure a quarter of your plate is from proteins. And then the other quarter, just carbs, like rice, pasta, bread, things like that. And another important factor that plays into nutrition is vitamins. Does anybody here, if you're willing to put your hand up, suffer from any vitamin deficiencies? Vitamin D, that's common.
Vitamin C, scurvy.
Yeah, vitamin C.
Scurvy.
Scurvy, yeah, scurvy. Does anyone know what scurvy looks like in a oral cavity? So I'll pass my iPad around for anybody who wants to see later. But here, I have a photo of what scurvy looks like. This is, come on. Actually, I don't know if everyone can see this, but this is a severe form of scurvy, okay? So the gums look cratered. The gums are also very inflamed, red, and they bleed very easily. So scurvy is a vitamin C deficiency. Yeah, vitamin C. So if you think you suffer from that, maybe talk to your healthcare provider to get some more advice on that. But so there's also vitamin A deficiency, which can lead to itchy skin, puffy swollen gums, and severe periodontal disease. Does anyone here suffer from vitamin B deficiency? Yeah, B12. Yeah, there's a lot of different like vitamin B. Yeah, B6, B12, B9, B3. So with vitamin B, it can lead to swollen gums. Your sense of taste can get altered. You might experience that your tongue might feel like it's burning. It might be swollen, cracks along your tongue, and also maybe cracks around your lips on the corners. There's also, like someone said, vitamin D. So when it comes to your oral cavity, your teeth are made of bones. And so vitamin D is very important in making sure that the bones of your teeth stay healthy. But not only that, but under your gums, you have bones that actually hold on to your teeth. And that's the bones that we as dental hygiene students research and look at and try to prevent from deteriorating in your mouth. Because what actually ends up happening is when that bone under your gums slowly deteriorates, you're gonna notice that your teeth become a little more loose, they become mobile, you might experience sensitivity deep in your teeth, and we don't want that to happen. So if you suffer from vitamin D deficiency, what happens is that bone starts to slowly shrink. Yeah, and we don't want that to happen because we need our teeth so we can smile, so we can eat, so we can talk, and all of those things, and communicate with other people. And there's also iron deficiency. Does anyone here suffer from iron deficiency? Yeah, a lot of people can suffer from iron deficiency. So common side effects of the iron deficiency, it also includes cracks around the corners of your mouth, and it can cause your gums to look pale. And it can also cause bleeding around your gums as well, and we don't want that to happen, okay? So I'm going to pass the mic back to Hina to talk about the periodontal disease process.
All right, so Jen covered everything really, really well. So I'm going to go over a little bit of gingivitis that she spoke about, perio, and then I'll pass it over to Rida, and she will go into perio a little more. So when it comes to oral diseases, the two main ones that we talk about is gingivitis and periodontitis. Have you guys heard about these before? Last time? Yeah. So gingivitis is basically something that is reversible. So some diseases are reversible and some are not. Gingivitis is the reversible disease while periodontitis is not. And if we don't take care of our gums, get gingivitis, and then if that transforms into periodontitis, we cannot come back into healthy gums. So gingivitis is mostly just swelling of the gums. They become red, inflamed, they hurt, they bleed. You'll notice if you're not flossing in between your teeth, they're swollen, they're not as nice and stippled that Jen was talking about. But from gingivitis, we can go back to oral health very easily if we have good oral self-care at home. What do you guys think good oral self-care would be basically? Yes.
Brushing twice a day.
Brushing twice a day.
Flossing and picking with water pick.
Water pick.
And flossing and mouthwash.
Mouthwash, yes. How about tongue cleaning? Do you think it's important to keep our tongue clean? Yes. Why do we need to keep our tongue clean? What do you guys think? What happens if our tongue has a lot of bacteria on it?
Bloated and fungal infections.
Yeah, we can get infections. We can also have bad breath. If your tongue has a lot of bacteria on it, you're not cleaning it, you can also get bad breath, which is why sometimes our mouth might have a little bit of a smell. So it's important to make sure that you're brushing twice a day, you're flossing, you're cleaning your tongue with a tongue cleaner, and then also mouthwash is really good as well. So after gingivitis, so let's say we're not going for regular checkups, dental hygienist is not cleaning because we're not making sure that our oral self-care at home is proper, our gingivitis can turn into periodontitis. And then when it turns into periodontitis, there's different stages and grades, which Michael is now going to talk about perio. So gingivitis, again, guys, is reversible, but periodontitis is not. Sorry, Rita will talk about perio.
Hello guys, I'm Lada. I'm going to talk about the periodontitis. So periodontitis, as Veena said, that it's irreversible, which means that if you get periodontitis, you cannot go back to health. If your gums have gone down back the perio disease process, so they won't go back to health. Which means that you need to take care of your dentition, you need to brush, you need to floss. Because if it's gingivitis, it's going to go back to health. But if it's perio, then it won't. So in perio, it's categorized by bone loss, and bone doesn't come to its actual level. It will only go down. So even if you don't have teeth, you make sure that you take care of your gums so that the bone doesn't go down. So you have to make sure that if you have teeth, that you're taking care of your teeth by brushing twice a day for 2 minutes and then flossing every night. Because if it moves on to perio, then it's not coming back. But if it's gingivitis, it's gonna come back. So I'm now gonna hand over to Michael to talk about some cavities.
Hello everyone. So who here has heard of cavities? So who knows what causes cavities? Does anyone have an idea of what causes?
Properly.
When you're not cleaning
Brush at night.
and brushing,
Yeah.
sweets. Okay, anything else? Bacteria. So a lot of people think when we eat a lot of sugar, so a diet that has a lot of sugar or a lot of junk food, they think that's what causes the cavity directly, but it's actually the bacteria in our mouths. Right? So the bacteria, what happens is when we eat a lot of sugar, the bacteria are actually capable of fermenting that and breaking that sugar down into acids. So who knows what a dental plaque is?
It's just the deposition.
Yeah, so you know sometimes on our teeth, you know, if we haven't brushed, sometimes you might feel film on the outside of your teeth. So that's what we call dental plaque. And dental plaque is basically full of bacteria, debris, food debris, dead skin cells. It's a mixture of all kinds of things. So the bacteria in the plaque produce acids that sit on the teeth and eventually cause it to demineralize, to break down. So the outside surface, has everyone heard of enamel? Enamel? Yeah, so the enamel is the outside surface of the tooth, and it's the hardest structure in the human body. And what happens is when the enamel is exposed to acids, it actually starts to break down the mineral structure. So what happens is if the demineralization continues, it starts to break that enamel down, causing a cavity. Now, when cavities are within the enamel, depending on how big they are, they can be arrested, they can be stopped with regular hygiene techniques, as well as with fluoride treatments as well. So who's heard of fluoride? Fluoride? Alright. Yeah, so a lot of toothpaste that are available on the market have fluoride. So the fluoride actually helps to remineralize the enamel after it's been demineralized. Right? So it helps to make the teeth a lot stronger to resist the acid that's produced from the biofilm or from the plaque.
What is the name of the toothpaste?
You can use anything as long as it has fluoride, right? But there's some toothpaste on the market. So let's say if you have sensitivity, right? You can use something like Sensodyne, right? Or there's Colgate sensitive toothpaste as well. There's different brands, right? But the main
Sensodyne is good.
I'm sorry?
Sensodyne is good.
It's for sensitivity. So if you have, like, if your teeth are sensitive, so let's say if you're eating or drinking cold water, right, or hot foods, and you find that your teeth are very sensitive to that, you can try Sensodyne and see how that helps. So it helps to block the pain signal, right? But the main thing is when you're looking for toothpaste, try and find toothpaste that has fluoride. So fluoride is the main thing that's going to help to prevent cavities.
There is sufficient fluoride added to the water.
Yeah. So sometimes in some areas, so in Mississauga, we have adequate water fluoridation, but in some areas they don't have fluoride added to the water, right? Or in some areas there might be too much fluoride. So if you have too much fluoride, right, what can happen is when teeth, especially more in kids, when the teeth are developing, you can start to see pitting, and the teeth might have a little bit of like a white finish onto it. But in Mississauga, we have our water fluoridation level is proper.
I have one question. Coming back to sweets, if you use too much sweets, normally in the process, bacteria converts a acidic environment.
So if you're eating a lot of sweets, right? So it's not so much as the quantity of sweets, it's more of the exposures, right? So let's say if you're frequently snacking throughout the day, so let's say you have, for breakfast you have something sweet or something that's like a fermentable carbohydrate. If you have something like that with breakfast, and then right after breakfast, a couple hours later, you have like cookies, let's say, right? And then for lunch, you have something else again. So the amount of exposures that you have throughout the day, if you're snacking, especially between meals, that's the main thing.
No, actually, my question was, in the process of breaking down the sugar or sweet, it creates acidic environment.
Yes.
So the damage due to that acidic environment or something else?
It's so the plaque that's sitting on our teeth. So when we don't brush that plaque off and we keep that plaque on there, it's constantly producing acids because the plaque is full of bacteria, right? So those bacteria are continuously breaking down the sugars that we eat, and if it's just sitting on the tooth, over time that tooth is going to start to demineralize, and the cavity or the bacteria, the acids, are going to start to break that down even further. So what happens is if you don't remove that plaque and the bacteria is allowed to just sit there, right, what can happen is the cavity can start to penetrate deeper into the tooth. So when you start to feel pain, that's usually a sign that it's past the enamel and it's into the second layer of the tooth, which is called the dentin. Right?
Okay, thank you.
So how many times should we floss? So the best thing to do is to do it minimum 1 time per day at night. So the reason why at night is because throughout the day we're eating, right? So before we go to bed, it's best to remove anything that's in between. It's good if you can do it every time after you eat something. That would be the best.
The dentists usually say like just do flossing once, like before bedtime.
Yeah.
But in the daytime, like you are keep eating.
Yeah.
And they sometimes like the vegetable or something get stuck in your teeth.
Yeah.
So you can do the flossing.
Yeah. You can floss as many times throughout the day. It's best to do many times, but a lot of people, they can't floss throughout the day. But if you're gonna do it only once, it's best to do it at night. But it's best thing to do is after each meal, right? Just to remove and clean out in between the teeth so nothing is sticking.
But does not say that the water flossing is better than the other flossing because we have breathed and everything, and when we do that, it comes out.
So sorry, you said water flosser.
Yeah.
Yeah. So the water flosser is actually something that's really neat. It takes a little bit getting used to, but the water flosser, especially if you have anything like bridges or anything like that where it's difficult for you to get underneath, it flushes everything out. So it's able to clean everything from in between the teeth. It also cleans along the broad. Yeah, so you can get them from Amazon, Walmart, Costco. Yeah. So it's good. It's good to try it out and see how you like it. Like in the beginning, it takes a little bit getting used to, but it's definitely something that we would recommend. Any other questions?
Canadian Academy of Mental Health and Community Sciences. So CAD.
Any questions?
On for Ontario. For Ontario.
Please use mic.
The tongue cleaner?
Yeah.
Keep it close.
So the tongue cleaner is important to use every day because like she said, our tongue is a rough surface. You know how the tongue is not a smooth, shiny surface, it's very rough. So what happens is bacteria, food debris, any type of dead cells that might accumulate inside of our mouth, they can stick to the tongue. So think of it, I like to explain the tongue kind of like a rug, right? So if you have a rug, and people are walking over it all day long, and things just stick to it, right? So when you're removing, when you're brushing your tongue, and you're removing all of that energy that's on there, it helps to keep your breath fresh, but it also helps to remove any type of depression. So the goal when you're doing your regular daily denture, the goal is to remove as much bacteria as possible. Right?
So we are supposed to clean our tongue only once in the morning, at what time also?
You could do it, like it's best to do it at least once a day. So the tongue cleaning, probably most likely best to do in the morning, but if you can do it twice, it's the best.
Okay, thank you.
You're welcome. Okay, so I'm going to hand it off to the next group who's going to be discussing denture care.
I would like to request you to keep this mic near your mouth because most of the seniors, they are hard of hearing. So your polite voices, that is not sufficient. So kindly a little bit harsh voice. Thank you very much. So kind of you having understanding their problems. Thank you very much.
Thank you.
This is another set of presentation. I think the first one was wonderful and they deserve clapping, applause for that. Wonderful presentation. We are highly thankful to you for this informative session which you had. So now we are going to have another session on oral health. I think this too is very interesting, and with the same request that kindly keep your mic close to your mouth so that everyone can understand, so they have a little bit. And if possible, kindly let it be by linguistic or Hindi, Urdu, Punjabi and English. Definitely that will be preferable. So thank you very much. But every presentation is wonderful.
Hi everyone. So namaste as well. Okay. Wow. So my name is Bhumika. My group members have Harjeet, Victoria, Hafsa, Mankiral, and Jenna. So as like previous group, they discussed the general health about the oral cavity, like what should be the ideal requirements, what is the healthy mouth looks like. So they all talked about that, plus the cavities, which we call it as like the bacteria starts eating the teeth. And we gonna talk about the dentures. You guys have all heard about the dentures, right? महंगे quality. I will check that as well. बिल्कुल. तो sorry. So actually उनकी ना मेंटेनेंस चाहिए होती है, like particular, तभी कहते हैं कि dental visit हमें regularly करवानी चाहिए. तो इसीलिए आप like how often do you go to dentist? How often do you go to dentist? Twice a year. Twice a year. That's good actually.
They demand a lot of money.
They do.
We avoid to go.
See, that's why we're gonna talk about at the end. We're gonna talk about the senior programs that the government provides you. So our group will talk about that as well, plus the denture care, how you should take care of the denture as well. So now Jenna, she will take over.
Hello everyone. Okay, so I have a question for you, and this one is going to be worth a prize, so your own tongue scraper. Okay? So the question is, for how long each day should you have your dentures taken out of your mouth, at least? How long?
8 hours.
8 hours, yes, very good.
No,
Yes, she's absolutely right. So it's 8 hours a day.
this is bias. We don't have denture. There must be some kind. There must
Then
be
you get even
some.
more rest with your tissues,
There
right?
must be some gift for us also.
Oh, there is. Don't you worry. Don't you worry.
Thank
Okay,
you.
so
Just joking.
that's right. So 8 hours a day. So when would be a good time to take out your dentures then? If it's 8 hours. Nighttime. You're already asleep anyways. Let your tissues rest. Let your tissues breathe. Right? We don't want our tissues if they always have a denture on them. Right? There's pressure on there. There's bacteria sitting under there. So it's important for our tissues to take a nice break. Take 8 hours to relax. Let the blood flow again into them. So that's a good time for us to take the opportunity to clean our dentures, right? So, why is it important to clean the dentures? Well, there's lots of different reasons. So, stains, right? I'm sure some of you love tea, love coffee, drinks, juices maybe, right? But all these things are foods as well. They have spices in them. We all love having a little bit of spice in our food, but the spice can cause staining. So if you're eating and you have your dentures in, your dentures can pick up these stains. So we want to clean them to take some of the stains out before it becomes permanent, right? Number 2, so plaque, which Jian was talking about earlier, plaque. It doesn't go just on our natural teeth. It can go on the fake ones in our mouth as well, right? It's a myth that you don't have to clean your dentures. Just because you don't have real teeth doesn't mean the fake ones don't need to be cleaned too. They're sitting in our mouth. You don't want all that germs sitting in your mouth, You don't want that, so you want to keep that stuff clean. What happens when we don't remove the plaque? It looks stained, right? It has that yellowish color to it, maybe a little bit browner for have a lot of staining products, right? But it hardens and it turns into something we call calculus, or you might hear it as tartar. And that can happen in your dentures too. So if you let that plaque sit there and it doesn't come off, it's going to harden and it's going to be even harder for it to come off, and you're not going to be able to brush it off. Okay? Fungal infections. So bacteria are in our mouth. Fungus can grow in our mouths too. So it can grow on our tongues, which is why tongue cleaning is very important. But it can also grow underneath our dentures, especially when it's on the upper, on our palate, on that hard bone on the top of our mouth. We can get kind of fungal infections there, especially we see it in patients that they don't take out their dentures, they don't let their tissues have a break, they don't clean up there. So fungal infections can develop. Okay. The quality of the denture. We paid, right? If you have a denture, you know it costs a lot of money, right? And you don't want that plaque to be breaking it down, right? You want to keep it clean. You want to keep it for as long as you possibly can. So keep it nice and clean. And of course, bad breath. So we brush, we use mouth rinse, we floss, we do all these things. We clean our tongue to keep our mouth smelling good. Why wouldn't we want the same thing for our denture, right? So it's very important for a lot of reasons to keep our dentures clean. And now I'm going to pass the presentation off to Victoria, and she's going to tell us how. Sorry? Oh, both of them are good, yeah. Both of them can be good. So there's types of dentures where they just get popped into the mouth. There's type where they're supported by implants. Sometimes they're holding on with a little clasp onto the tooth. Whatever your dentist thinks you need, right? Because it depends on how many teeth you have, what the bone looks like underneath. So your dentist would be the best one to tell you, or your prosthodontist would be able to tell you, the denturist, what kind to get. Yeah, so it all depends on what you need specifically.
और बाकी के मुंह में दांत है और बाकी के फ्रूट है तो फिर हमने परमानेंट डेंचर में लगवा सकते हैं।
मैं आपको हिंदी में बता देती हूँ, ठीक है? तो आपके जो आगे वाले दांत नहीं है तो पीछे वाले हैं, तो आपको सारे निकलवाने की जरूरत नहीं है अगर आपके दांत हिल नहीं रहे। जो आपका डेंटिस्ट बताएंगे, आपका लेवल चेक करेंगे, अगर तो वो आपको कहेंगे कि आपके ये दांत निकाल के आपको सारा ऊपर वाला लगवाना पड़ेगा तो आप वैसे लगवा लो। अगर आपको कहते हैं कि आपके ऊपर वाले दांत ठीक है जो पीछे रह गए हैं, उनकी सपोर्ट से भी आपके आगे वाले दांतों में डेंचर लग सकता है जो आप उतार सकते हो या फिक्स भी लग सकता है। अगर वो कहते हैं वो भी लग सकता है। अगर आपके बोन ठीक है, वो आपको कहते हैं कि आप पे इम्प्लांट लग के वहाँ पे इम्प्लांट भी लग सकते हैं, आप इम्प्लांट भी लगा सकते हैं। सो इट इज़ कि आपका डेंटिस्ट आपको क्या कह रहे हैं, आपकी बोन हाइट कैसी है, आपके टिश्यूज़ कैसे हैं, उसकी हेल्थ कैसी है, वो सारी चीज़ें देख के जो वो डिसीजन लेंगे कि व्हाट इज़ बेस्ट फॉर यू, दैट देन यू कैन मेक अ चॉइस आपको क्या चाहिए। So, सेरेमिक भी अच्छे हैं। So, कब ऐसे होता है कि सबके किसी के होते हैं कि सारे दांत हिलने लग गए हैं, उनको होता है कि सारे इकट्ठे निकलवा ले तो ज़्यादा अच्छा होगा। कभी जैसे इनका है कि इनके आगे वाले ही निकले हुए हैं, पीछे वाले हैं। So, if they can save the back ones, and she just needs a denture for the front ones. So she has options. एक तो होता है कि रिमूवेबल होता है, वो निकल जाते हैं कि जस्ट फ्रंट वन लेते हैं और उसको निकाल सकते हैं, वो लग सकता है। या अगर इनके पीछे वाले हेल्दी हैं, इनकी सपोर्ट से फिक्स्ड भी लग सकता है आगे ब्रिज, दैट से दे से ब्रिज, तो पीछे वालों की सपोर्ट से आगे ब्रिज भी लग सकता है। एंड द अदर ऑप्शन इज इफ शी हैज अ हेल्दी बोन एंड हेल्दी गम्स, तो यहाँ पे इम्प्लांट्स भी लग सकते हैं। इम्प्लांट्स की सपोर्ट से भी, 1 या 2 इम्प्लांट्स की सपोर्ट से भी वहाँ पे उतना डेंचर लग सकता है। सो दैट 4 implants are if you don't have any teeth, but if you still have some teeth remaining, then you can have a over denture with the help of your own teeth. So आपके अपने दांत उस डेंचर को सपोर्ट दे सकते हैं, वो भी ऑप्शन हो सकती है आपके लिए। सो इट डिपेंड्स कि आपकी बोन हाइट कितनी है, आपके हाउ हेल्दी आर योर गम्स। बेस्ड ऑन दोज थिंग्स the dentist can tell you which option is best for you, and then you can make the option, like you can choose the option what you think is best for you.
Right. Because sometimes they say you select. I will tell you this. You have to decide which one.
Okay. Sometimes it is like okay, your fundings also. Some people say like, okay, this might be the best option, but I can't spend this much. So, and sometimes it is like, okay, this is best option, but I am not okay with daily removing it or having it whole time in my mouth. I would rather go for a removable one, or I would rather go for implants one. So it all depends what you feel like it's good for you. He can help you in making guiding the decision, but he can't say, okay, this is the best for you, because at the end you have to make a decision for yourself.
ये पार्सल डेंचर बनता है, ये बगैर वायर के भी बन जाता है।
For that, वो एक क्लास होता है, वो आपके जो पीछे वाले दांत हैं उनके ऊपर लगा देते हैं, उससे सपोर्ट आ जाती है, वो हो सकता है।
जो वायर वाले ही बनाया उन्होंने, इससे ही मेरे दांत निकल गए सारे।
Like after how long do you go to a dentist?
जब दांत वो डेंचर साथ वाला दांत सील जाता है वायर से।
So I would suggest minimum is after 6 months, like 6 महीने बाद is minimum you have to. But अगर someone is having diabetes, might be होंगे आप में से किसी को डायबिटीज भी होगी, तो डायबिटिक पेशेंट को आफ्टर एवरी 3 months, बिकॉज डायबिटिक पीपल आर मोर प्रोन टू इन्फेक्शंस, उनकी इन्फेक्शन ज़्यादा होती है, उनके बोन जल्दी कम होती है, तो उनको आफ्टर एवरी 3 months दे हैव टू विजिट द डेंटिस्ट एंड गेट द चेकअप्स डन। एंड डायबिटिक पीपल उनको इन्फेक्शंस भी ज़्यादा होती हैं, तो चांसेस हैं कि जो आप कंप्लीट डेंचर ऊपर लगा रहे हैं, अगर आप उसको नहीं रिमूव कर रहे, सबसे ज़्यादा इन्फेक्शन उनमें होने के चांसेस हैं, बिकॉज डायबिटिक्स की हमारा इम्यून सिस्टम कॉम्प्रोमाइज होना शुरू हो जाता है, तो हम ज़्यादा इन्फेक्शंस हमारी बॉडी में आती हैं। सो वी हैव टू विजिट द डेंटिस्ट एटलीस्ट आफ्टर 3 months इफ यू हैव डायबिटीज, एंड इफ यू डोंट हैव डायबिटीज एटलीस्ट आफ्टर 6 months. Now Victoria is going to take over.
Thank you, Margaret. I hope that was helpful for you guys, because she's very good at explaining stuff like that. So I'm going to teach you how to clean your denture. So if you're going to get a denture, or maybe you already have one, this is very important. So like Jenna said, the first thing you do
is at night before you go to bed, you have to take it out. Okay, so there's a couple different things you can use to clean your dentures. There's one called Polydent, which is a tablet. You put it in water and you stir it around, and then you put your denture in the cup with it, and it will clean it. It will remove bacteria, and especially the bacteria that causes it to smell bad. Another thing you want to do is you want to have a denture toothbrush. These are important because they have two sides, so they can clean the top and the bottom, and then with the skinny side, it can clean kind of around in the clasps. The clasps are what go around your tooth, and so you need a skinny brush to clean in there. To use with the brush, you do not want to use regular toothpaste. Do not use regular toothpaste to clean your dentures, because in regular toothpaste, there's what we call abrasives. So it's like little beads, and what that can do is on your teeth it removes kind of the stain, but on your dentures it will remove like the outside parts of the denture, and you don't want that because after a while it can start to ruin it. So you want to use soak it overnight in the water with the tablet, and then in the morning you want to brush it before you put it back in. Also important, so when it's time to brush your denture, you either want to fill up the sink with water or put a towel on the bottom. So just in case when you're brushing, if you drop it and it falls, it's not gonna break, okay? But there are lots of different options. You can buy at the dollar store. You can buy a denture brush, I think, for $1.50. Same thing with the tablets, $2 or $3 at the dollar store. And if you follow that, then your dentures will last a long time. Okay, so I'm gonna pass over to Hafsa, and she's going to talk about a little bit about different programs that you can use, so that are affordable for dental cleanings and stuff like that. Okay. Hello, everyone.
Hello everyone, it's a pleasure to be here. Thank you for having us. So I'm going to be briefly talking about, first of all, before we go into the programs, is why do we need to keep our mouths clean, okay, including dentures. So number one thing is that imagine the entryway to your house, right? Imagine it being filled with mud and goo and gunk. And every time you're entering your home, you're entering through that entryway. What's going to happen to your home? It's gonna get dirty, right? So the similar analogy can be used to our mouth. If our mouth is dirty, whatever we are eating, the bacteria from our mouth is going into that food, then going in our body, regardless of how healthy that food is, right? So I'm gonna be translating this. तो आप ये imagine करें कि आपका घर की जो entrance है खराब है, गंदी है, कचरे से भरी हुई है. अब हर दफा आप घर के अंदर आएंगे, आपको कचरा साथ लेके अंदर जा रहे हैं. तो imagine करें आपका घर कितना गंदा हो रहा है. So similar concept is for your mouth और आपकी body.
Very good example. Very good example.
तो अगर आप अपने dentures की ख्याल नहीं रख रहे हैं और आपको हो गया फंगल इन्फेक्शन, आप जो भी खा रहे हैं वो इन्फेक्शन आपकी बॉडी में जा रहा है, ठीक है? और वो सारा कुछ एक्सरबेट कर रहा है, उसको रूइन कर रहा है. जो अगर आपको प्रीवियसली डायबिटीज है उसको और एक्सरबेट कर रहा है, अगर आपको प्रीवियसली हाइपरटेंशन है उसको और एक्सरबेट कर रहा है. तो आपकी ओवरऑल हेल्थ बहुत ज़्यादा इम्पैक्ट हो रही है. सो इफ यू हैव हाइपरटेंशन और डायबिटीज एंड you previously have it and you get, for example, Candida's fungal infection from the denture care, and you don't take care of it, right? Whatever you're eating will exacerbate that hypertension, will exacerbate that diabetes, in turn causing your overall health to deter, okay? And then now I'm going to be talking about the benefit, the Canada or senior care program that exists here. So if you are, and dental benefit as well. So if you're 65 years of age and older and you're a resident in Ontario, you have an annual net income of a single person of $22,000 or less, and if your combined net income is $37,100 or less, then you are provided the Ontario Seniors Care Program. dental seniors care program. And you can go on the canada.org website and look into this program and apply online, okay? And if something that you need help with, you can go to your dental office and ask them for this program as well, and they will help you. Another thing is that they just came out with the dental care benefit plan as well, which is now open for seniors. So if your net combined income is less than 90,000, you will be qualified for that. So that is a very new program. Some dentists have taken it, some have not. So that's something that you might want to call beforehand to your dental office and ask them. तो अगर आपकी net income 22,000 से कम है और combined net income 37,000 से कम है, तो आप qualify करेंगे Ontario Seniors Dental Care Program के लिए. इसकी detail आप online देख सकते हैं canada.ca पे, और आप अपने डेंटल ऑफिस जाके भी उनसे रिक्वेस्ट कर सकते हैं कि आपको इस प्रोग्राम में एनरोल कर दें. और जो नया उन्होंने बेनिफिट निकाला है CTSP प्लान, वो उसमें 90,000 से अगर आपकी कंबाइंड इनकम कम है तो आप उस पर अप्लाई कर सकते हैं. वो फिलहाल सीनियर्स के लिए ओपन है. तो आप पहले अपने डेंटल ऑफिस फ़ोन करें, उनसे पूछें कि आपने ये प्रोग्राम रेगुलेट कर दिया, क्योंकि सब डेंटल ऑफिस रेगुलेट नहीं कर रहे हैं जी. तो अगर उन्होंने कर दिया है तो फिर यूर मोर देन वेलकम टू. अगर उन्होंने नहीं किया तो आप बाकी डेंटल ऑफिस पूछ सकते हैं. आसपास जितने भी डेंटल ऑफिस है गूगल करें नियर मी, उनको फ़ोन करें, उनसे पूछें आप लेते हैं, जो भी लेता है आप उससे फिर जी. तो उसका बहुत अच्छा ये हुआ है कि अब आहिस्ता आहिस्ता वो और लोगों के लिए भी खुलेगा, तो बहुत सारी अपॉर्चुनिटीज खुल जाएंगी लोगों के लिए.
मुझको तो मिल गया है, लेकिन वहाँ पे नहीं आई तो किसको कॉन्टेक्ट करना है?
नहीं तो अब जिस आपने खुद अप्लाई किया था या आपके डेंटल ऑफिस ने आपके लिए किया था, तो फिर आप उस पर देखिए ना, कॉन्टैक्ट इन्फॉर्मेशन होगी नीचे.
वो एज के हिसाब से दे रहे हैं. पहले उन्होंने 100 वालों को दिया, फिर अब 90 से 80 तक को दिया है. अब 80 से जो नीचे हैं उनको
जी. नहीं आप कीप इट, दो हफ्ते देखें, 2-4 हफ्ते देखें, नहीं आता तो
हमारा नहीं आया.
1.5 month. तो मुझको तो आ गया, इवन आई गॉट द कार्ड, लेकिन वो उसको लेटर भी नहीं आई, क्योंकि लेटर के ऊपर एक कोड आता है. अगर आपके पास कोड नहीं है तो आप ऑनलाइन के साथ बात नहीं कर सकते. They want your code.
आपने अपना कोड लगा के फोन करके पूछा कि मेरा हस्बैंड का नहीं आया, मेरा आ गया, इस तरह क्वेरी किया?
नहीं, वो बात तो नहीं करते ऑनलाइन, वो तो उनका
चैट जो भी है आप अच्छा उसमें उन्होंने कोऑर्डिनेट नहीं किया, आपको नहीं बताया?
नहीं मुझे दे.
हाँ मुझे, क्योंकि मैं उनसे हूँ नहीं तो मुझे इसलिए पता नहीं था.
बेटे ऐसे है, मैं इनको बताऊं, आप कृपया सर्विस कनाडा के पास जाइएगा. मैं भी वहीं गया था और इंसिडेंटली वहाँ बहुत टाइम लग रहा था. फिर मैंने अपना मोबाइल निकाला और वहीं से उनको वो फार्म भर के तो वहीं दे दिया. हालांकि आई डिडंट बॉदर मच एट होम, आई डिडंट फिल दैट फॉर्म. सो दैट इज बिकॉज योर हस्बैंड इज सीनियर टू यू, दैट इज व्हाई he had an opportunity to get a letter earlier than you. आपके बाद नहीं, उनसे क्योंकि आपसे उम्र में बड़े हैं तो उन्होंने एज वाइज वो भेजने शुरू किए थे. सो देयर इज सम सॉर्ट ऑफ मिसहैंडलिंग और समथिंग लाइक दैट. तो उसमें आप सर्विस ऑन्टेरियो, देयर आर 2 things. One is Service Canada, the other one is Service Ontario. Don't go to Service Ontario, go to Service Canada. They will give you full information. Definitely, which is Service Canada, that is there. And secondly, which is at Dundas also, here on Glen Erin and Dundas. There, because it should be, these are 2. One is Ontario, the other one is Canada. सर्विस कनाडा. यू हैव टू गो टू सर्विस कनाडा.
जहाँ पे ड्राइवर्स लाइसेंस रिन्यू करा,
जी ड्राइवर लाइसेंस बनते हैं और आपका पासपोर्ट भी बनता है.
Another question over there.
There is a question.
ये 2 प्रोग्राम है, एक सीआर के एक है पील वालों का, राइट? तो पहले हमें सीआर को फ़ोन करना है, फिर वो आपको नंबर देंगे. फिर अपने सर्विस कनाडा को, नॉट ऑनलाइन, इफ़ यू डोंट हैव एक्सेस यू कैन कॉल देम. दे गिव यू कंफर्मेशन नंबर देखते 28 डेज लगेंगे उनको सारा कोर्स कर भी आप एलिजिबल हो कि नहीं हो। उसके बाद वो 2 महीने के बाद सन लाइफ का पैकेज भेजेंगे।
थैंक यू सो मच, थैंक यू सो मच फॉर दैट। तो आपने देखे 2 उन्होंने बताया कि 2 इसके स्टेप्स।
Do you guys have kids or grandkids? So you have? Tell them. They will help you.
We help the grandkids don't eat any candy.
Yeah. They can help you with everything that's online on the internet. They're good at that.
There's also the child that you can talk about.
That's the child.
For the children, so if you have grandkids.
Yes. If you have for your kids, if you have kids or you have grandchildren, you can tell your kids that there's also a benefit that kids under 17 can get free dental cleaning and dental work at a reduced price, at a discount, and it's called Healthy Smiles Ontario. So if your children don't have insurance and that your grandchildren can't go to the dentist, then tell them about this program. They can sign up and they will get money so that their kids can go. Healthy Smiles.
So now Mankirat's going to talk about a little bit of myths regarding dentures.
So now I'll be talking about some common myths and facts. So one common myth amongst everyone is, if I don't feel like I have anything in my mouth, I don't need to visit the dentist. Right? Pain नहीं हो रही है, कोई soreness नहीं हो रही है, that means my mouth is healthy and I don't need to see the dentist. So this is a common myth. The fact is you don't know what is going on in your mouth. You might have infections and that infection, जैसे पहले वाले ग्रुप ने बताया कि गम्स की प्रॉब्लम पहले शुरू होती है, वो सिर्फ आपके गम्स में ही रहती है. If you like clean your teeth regularly and if you get like dental scaling after every 6 months or 3 months, whatever your dentist says, that is reversible. So you can again have healthy gums. But अगर आप नहीं क्लीन करवा रहे हैं, वो इन्फेक्शन आगे बढ़ रही है, वो आपकी आगे बोन्स तक पहुंच के जाती है. फिर बोन्स तक जब पहुंचती है, that is not reversible. Once your bone starts resorbing, you can't get it back to normal. So you have to visit the dentist after every 6 months if you have healthy mouths, and if you are diabetic, and then you have to visit the dentist after every 3 months. And another common myth is once you have the denture, your denture is fitting properly to you, you don't need to see the dentist because it is fitting properly to you and it is serving the purpose that you want. Okay, इसके साथ मैं खा सकता हूँ, मुझे नहीं dentist के पास जाना. That is also wrong because you don't know what germs are there on your denture or if it is working properly or not. And might be अगर आप denture उतारो, उसके नीचे अगर कोई fungal infection है और आपके gums की overgrowth हो गई है, कोई bones resorb होनी शुरू हो गई हैं, that you don't know. But if you will go to the dentist, he will have a look into your mouth, and अगर उसके अलावा कोई और problem है, then he can guide you further. That okay, this problem is developing in your mouth, you might need treatment for this. That is also a common myth that okay, हमारा काम चल रहा है, हमारे dentures सही हैं, we don't need to. And the another thing is, okay, my denture broke, I will go see the denturist, but I won't see the dentist. That is also a common myth कि denturist मेरा काम कर देगा, but dentist के पास मैंने नहीं जाना. Denturist can help in fixing, but he doesn't know the problem underlying. Might be आपका denture आपका fit होना बंद हो गया है. The reason is your bone has resorbed. You might need another denture. आपका दोबारा से impression लेंगे dentist आपका, फिर दोबारा से आपका denture बनेगा. So you have to visit the dentist to get the checkup done. It is not कि okay मुझे पता है तो it is okay and मुझे कोई problem नहीं हो रही है. It is you don't know what is going in unless you don't see a dentist who has who knows about the things and who can guide you. So I would suggest please visit the dentist after every 3 to 6 months as per your health. If you are diabetic, after every 3 months, and if you are if you don't have any underlying disease, at least after every 6 months, do visit the dentist or dental hygienist.
How long we should visit the dentist for cleaning teeth?
For cleaning, so that's what I was telling you. At least after 6 months.
Not with dentist, without dentist.
Without if you have healthy teeth, your teeth also 6 months.
That's good.
And diabetics, if you're diabetic, then 3 months.
How about once a year?
It's okay, but ideally it's 6 months.
That's good.
But something is better than nothing. Rather than not going to the dentist at all, at least you are going once a month, year, it's fine. But try if you can go in 6 months or 3 months.
Thank you.
More often, then your teeth will get thin, then they will get thin or they will get weak or something like that. No, it's a common myth. So this is just a myth. So if you don't get your teeth cleaned and if you don't brush properly, you don't floss properly as the other group told, the bacteria builds up. Then it forms plaque and it hardens. So that hardened structure is your tartar. We call it calculus. You feel like a tooth structure around your teeth. And if you don't get it clean, it is going to infect your gums and your bones. So you might feel like, okay, you have a support with your teeth, but that support is actually ruining your teeth and your gums. So you have to get it cleaned and take it off. And the other thing is people, look, okay, dentists might tell you okay, because when there is a huge bone loss with that tartar buildup around your teeth, the dentist might tell you okay, this might loosen your teeth. But the chances are that might tighten, the gums might tighten around your teeth. And if you have slight mobility, जो थोड़ा थोड़ा हिल रहा है दांत, तो वो कम भी हो सकता है. So we all have got such clients, senior patients with our clients. हमारे clients में था किसी के mobility थी, हिलते थे. Once we cleaned their teeth, when we told them there are chances it might start loosening a little bit more, but there are chances it might heal also. With most of us, what happened? The gums tightened around the teeth, and the teeth became firm, and the slight mobility that they had, it went back to normal because gums tightened around the teeth. Yeah. So Jenna is now. I'm going to give it to Jenna. Jenna is going to talk about.
Okay, thank you so much. So we're coming to the end of our presentation. Thank you all for listening. So one more time, I can't remember. How long at night are we keeping our dentures out? No. How long was that again? 8 hours? Is that you? You don't want it? Over here? Here, I'll pass it down. There you go. Okay.
She wants it like
I don't have any money, but what I do have here, I don't think I quite have enough for everybody to go around. But if you're not somebody who likes to use floss, I have what's called an interdental brush. They're tiny little brushes and they just go between your teeth. Use them just one time in all your teeth and then throw it out. It's not for you to use forever, but it's just a little sample. And if you like something like this, I think the dollar store has them right now. The grocery stores might, if not Amazon has them. In Walmart, yeah. There you go. This one's just one time. So if you'd like one, I'm going to leave them up here at the front table. Just take one. And thank you for everybody for participating today. Thank you. Thank you.
Let us give a good applause, please. Clapping for both the sessions. First one and the second one. The presentation was very informative, very good, and I will request their professor Harshini Ramesh to kindly make it a regular feature so that they can come and they can give presentations here with our seniors. It was a wonderful session. Thank you very much for coming and joining us and giving lot of information about dentistry and oral health, and the other one that was the first presentation was also very beautiful. Thank you very much. So nice of you. Thank you very much.
Thank you everyone for being so patient and for having us. Thank you.
Thank you. And secondly, you resolved the problem of language also, that you helped us that way.
So we have something for you.
Wow, Sat Sri Akal. Thank you very much. Thank you. We love our kids, you know, when they try to learn our language and culture. So anyway, thank you very much. So nice of you. It's a multicultural nation in Canada where everyone has a right to enjoy his own language and culture. So we are fortunate enough that we are Canadians now. So thank you very much. So nice of you. Really, I appreciate it. In case you feel like you can just have a cup of tea with us, in case you. So,